Hi everyone, I'm Dr. Bartos, and today let's discuss acne scars, and most importantly, how to prevent them and how to remove them if you have acne scars. As you guys know, most people experience acne. Actually, some studies show that up to 80% of people between the ages of 12 and 30 experience some kind of acne in their life. So what's happening? Why does this condition occur? The pilosebaceous unit, which is the hair follicle that grows out of your skin, has a sebaceous gland attached to it. So due to hormonal influences, this gland can sometimes produce too much oil. So we have medications that block this gland, such as Winlevi and spironolactone, to stop the hormone influence on this gland. Because when this gland produces so much oil, there's a bacteria called P. acne that comes and just eats up all the oil and forms this little abscess under your skin. This wouldn't be a problem if this oil could really come out and be extruded through the pilosebaceous unit. However, for many patients suffering from acne, the pore gets blocked so that now the abscess and the oil is stuck under the skin. So again, we have different medications to kill the bacteria and to exfoliate and to be able to unplug the pore that is blocked. However, when we allow acne to continue for long periods of time, people do get scars, and that is a problem. And why is that? Because treating acne scars, or really any scars for that matter, is very difficult. We do have good treatment options for scars, and we start sometimes by exfoliating with chemical peels. We have mild, moderate, and deep chemical peels depending on your skin quality, depending on how dark your skin is and how deep your scars are. The next level of treatment is microdermabrasion, where different machines or different tools are used to shave off the top layers of the skin, again to exfoliate and remodel your scar. Now we're getting deeper. Another procedure that we have to help you remodel your scars are things like microneedling, where we have multiple needles going in and out through your skin. I personally use the Exceed from Candela, and this causes a controlled injury to your skin, and it allows an old scar to become a new scar so your body can heal, remodel, and change that scar. If you need even more help, we can do also punch excisions, where with a sharp instrument we go in and we core out your scar. We either put a stitch to close the hole, or we can take a graft, usually from behind the ear, of a little piece of skin, and we place that in the hole that we just made. That's not a commonly done procedure, but it can be done. Now, when it comes to energy devices, we have different ones. We have resurfacing lasers that simply shave off the epidermis, again to help you remodel the skin. We have IPLs, or light therapy, and we have things like Morpheus, which is again microneedling with radio frequency, which can go down to 4 millimeters on the face and up to 8 millimeters on the body. And that is considered by most one of the most efficient way to remodel scars. And last but not least, we have fillers that we can use. Things like Juvederm or anything from Restylane products. And I also like to use a permanent filler, which is called Bellafill. We place the filler in the scars. The hyaluronic acid products only last for about a year or two. However, things like Bellafill are more permanent and long-lasting. And then in the process of placing the filler, we also do what's called subcision, where with the needle we go under the scar. We're cutting horizontally to release the scar from the way it's bound down to the dermis, and we lift it up so that it can heal in a new position now. Sometimes we place things like normal saline or a filler in that space, again to allow the healing to happen separated from the dermis. So we have all these tools at our disposal. However, the best treatment for acne scars is really prevention. That's why we dermatologists are very passionate about proper and aggressive treatment of acne. In my opinion, a child or a young person suffering with acne should be on an aggressive regimen that includes antibiotics for 2-3 months, maybe spironolactone, different topicals, creams, and cleansers. But if you're not better in 3 months, and by better I mean quite clear, you should go on Accutane. We need to treat the acne to prevent the scars, because once you get the scars, it's really hard and expensive to remodel them. So I'm very passionate about that, and I think you deserve to find a great physician or practitioner that will prevent the acne scars. And if you do develop the acne scars, now you know what to do. We have many instruments in our toolkit, and we can definitely help you. Let me know below what treatments you have tried, what worked for you, what hasn't worked for you, and hopefully you unfortunately don't have any horror stories, but let me know if you have any questions and we can always do a follow-up based on your interest. Make sure to subscribe and leave me a comment below.